Hi, I'm Dr. Tanya Yannick of Yannick PT.
And I'm Anthony Salem, owner of Big Creek Massotherapy.
So we came together, we wanted to join forces and start a conversational video about why we talk to other healthcare professionals, because we want to help our clients, and we can only offer so much within our scope, so we need other healthcare professionals to network with and provide for our clients when they need more than what we can offer.
Exactly, and every week we'll have a new topic that we're discussing, health and wellness topic, and what we can offer our clients, each other's clients, and other times we'll have another guest in to discuss what they do and how their therapies work as a standalone and in conjunction with ours.
So we're going to call it Care Collaborators, because Anthony is one of my care collaborators. I'm a physical therapist. So sometimes some people need maintenance massage, and I don't do massage. I do manual therapy when it's medically necessary, but sometimes I see clients would benefit from massage, and I try to work with local healthcare professionals such as him, or health and wellness professionals, and he's one of them, and it's one of my partner locations, so sometimes I'm seeing clients here as well. And why do you want to work with me?
Well, I come across clients who, no matter how much I work on a particular spot, it doesn't seem to want to release. Of course, the scope of my practice might not cover what is wrong, so I need collaborators to refer them to. I often tell people, you want to go see a physical therapist. Sometimes it's a chiropractor, sometimes it's an MD. I don't believe in telling people that I can fix everything. I believe that every one of us needs to stay in our scope of practice. So that's why we need other care collaborators to refer to, because it's about what's right for the patient.
Yep.
And there's a wonderful network of health professionals in Northeast Ohio, and we're here to start working together and helping the general public. That's why most of us got into this, because we care about people. We're in the midst of this opioid crisis, and these regular therapies will help people get off the pain pills.
Yes.
And back into enjoying life.
Yeah, I think both you and I have the same mission with a lot of our clients, is trying to keep them off of pain medications or medications in general. When, sometimes you need them, but we tried, the abuse of it is becoming an issue, and surgery sometimes are not required. Just because you have pain doesn't mean you have something abnormal that needs to be fixed, but right now, the medical system is kind of going that way, and we're trying to stay more holistic. So people trying to stay conservative, or want to try other options first, massage is an option, physical therapy is an option, so it's always good to have those options before you go for a more invasive procedure.
Right. And what's the old saying, treat the problem, not the symptom?
Yes. The root maybe.
Yeah.
Go for the root. I always say pain is actually the last domino in the domino chain effect. So having someone like a physical therapist like me do a fitness assessment, or say you have you might have a tight spot in your neck, but it might actually be coming from something else it's probably coming up from, the middle of your back or your low back, or, we know how to assess the body to understand, oh, wait, this is connected to this. And even though you're having pain and you're having headaches, it might actually be coming from your trap or that shoulder that you had an injury with, and you think it's totally not related, but we know enough about the body that we can connect the dots and get you that care, and hopefully get, some relief for you.
Exactly.
Yes.
Also, we're going to have a good time on this show too. Be a little silly, because it's our nature.
Yeah.
But hopefully we'll provide good information that'll help everyone out there watching make a good decision on what they need to help them get over that hump, get over the pain, the stress of life, and hopefully we can educate you on how physical maladies, to use a fancy word, and emotional stress are intertwined, and one affects the other and leads to the other. Emotional stress causes or manifests in physical ways, and of course physical pain can cause emotional stress. And that's why people like us are here, because sometimes going to the doctor, which we do not negate. I'm not saying don't go to the doctor. Oftentimes I'll tell people, I'll help you where I can, but this is the point. You need to go see an MD. You need to go get an X-ray. You need to go get an MRI. This is beyond what I can do. So hopefully we don't ever come off as saying that we're replacing physicians.
That's true.
They're very important.
True. Yeah. And hopefully we might get some physicians on here. Who knows?
Yeah, exactly. So, but yeah, we're here to help people who don't want to just take a pill and forget about it. People who care about their overall wellness, and it's a growing thing, especially amongst the generations, the age groups of 30 to 60 or 25 to 55, somewhere in there. Unlike our parents, the baby boomers, who worked really hard, destroyed their bodies, and didn't take care of their health. People want to feel good. They want to be healthy. And they want to live full lives. And we're just here to help with information.
Mm-hmm. And even across the healthcare professionals themselves, I come across people that don't understand what physical therapy is. I don't know if you've come across that, where they're like, oh, you just rub people, make people feel better. And you're like, no, actually there might be a little bit more to what I do. Or, you know,
exactly.
For example, like we were just talking about, you know, post-surgical cancer survivors, like how he can help with them with lymphatic massage and stuff. And obviously as a PT, I can help with range of motion and of the shoulder, you know, post, you know, surgery, just for an example. That will be a whole topic in itself. But a lot of times, even across the healthcare professionals, we need to educate each other to understand when it is good, because I think in an effort for a lot of the hospital systems to streamline, it's almost, there's so many specialties now, it's almost hard for us to understand everything that we can, you know, each specialist or each healthcare or wellness provider can offer.
Mm-hmm.
So,
exactly.
So we're going to have a lot of fun. Hopefully. It'll be silly.
Yeah.
But
and if we ramble, I'm apologizing in advance.
Yeah, we're going to. Just accept that. So.
Yeah.
All right. We hope to, I hope you guys enjoy our series that we start coming out with, and we'll try and be as educational as possible. If you have any input, you can always message one of our businesses, and there's always comments below the video that you can leave. Usually, if it's on one of the social media, you'll have a thread, either the YouTube channel or the Facebook post or whatever. We're going to be repurposing this across the board, so always leave us a little comment. Leave us a question if you have ideas for topics. We're more than happy to take input for that.
Well, why don't you tell the people how they can reach you? What's your website?
Yes, Yannick PT. Yep, yannickpt.com. And you can email info@yannickpt.com.
And you can find us at bigcreekmassotherapy.com. That's Big Creek, MASSOTHERAPY.
We didn't know it was going to be a spelling bee, right?
Well, .com. People get confused with massotherapy and massage therapy. It's the same thing, by the way.
Yes.
Massotherapy is another word for massage therapy. But yeah, bigcreekmassotherapy.com, 440-799-8988, and you can info@bigcreekmassotherapy.com. Visit our websites for more information. Reach out. We're here to help.
Great. We look forward to doing more content for you, and we'll talk to you later.